On the Medical Watch, the number of COVID cases continues to rise here in Illinois. Hospitalizations are inching up a bit as well, but deaths remain flat. It's a pattern happening across the country, but health officials say there is no cause for concern. Dr. Amal Tokars is the interim director at the Illinois Department of Public Health. She's taken over for Dr. Ngozi Ezike, and she joins us now live. Thank you so much for talking with us, all things COVID. Let's get started with the new news today. Moderna wanting to vaccinate all children. I think some parents are feeling like things are easing up a bit. Others are chomping at the bit to get their children vaccinated. What would you say to parents tonight?
Well, first of all, we'll want to wait for this final approval, but this is good news. And there are many parents that will be interested in this, especially parents that have little ones that they know that they can't wear a mask, or they're in crowded places, or they know that they have comorbidities. So this is good news, but we will wait for that final approval and then more to come.
Yesterday, I know Dr. Fauci said that the country was out of the pandemic phase. People were happy to hear that we're in this transition phase. What's your assessment for Illinois? Because I know the numbers are inching up, especially in counties like DuPage.
Yeah, so all over the country, numbers are inching up. The Northeast has been hit a bit harder, but we are seeing our numbers increase, and hospitalization is going up a little bit as well. Hospital capacity right now is overall strong, and death is stable. So these are good things. Illinois is overall on low levels. However, we should take care to be careful because COVID is with us. And so how do we live our lives and live them fully? We look at the fuller picture and the full lay of the land, and that is when we're in low community levels like we are now, we want to take that opportunity to be up to date in our vaccinations and get boosted. Even though we can still get sick when we're vaccinated, the vaccination is providing very meaningful protection against serious illness and hospitalization. So that is still very critical. For areas where we are seeing medium risk levels, we really want to protect those immunocompromised. And the CDC is strongly suggesting that those individuals think about taking on their mask in indoor public places, even if they don't have to, just to protect themselves. So those are individuals with comorbidities or elders or persons who are immunocompromised.
I want to talk about vaccination timing, especially for those boosters in just a moment. But first, I want to get a little more in depth about hospitalizations. I know with other states, they differentiate between COVID patients and other patients who may test positive for COVID. And Illinois only says, okay, anyone who's tested positive for COVID. Does that skew our numbers a bit?
You know, we really look at both. We look at people who have tested positive for COVID. We look at COVID patients in hospital, and we look at those new admissions. So we really look at all of that together.
Okay, let's talk about the boosters now, because I know some people are thinking maybe I wait until a booster comes out that addresses the variants a little better. What is the timing from the last booster to when we should be getting that fourth shot?
Well, first of all, people want to be very particular about the timing. They can speak with their provider. But right now, for individuals that have had their first booster, they would already at this time probably, if they got it right away, be eligible for their second booster. And here's the thing, you're making a point about maybe boosters of the future that would be developed against these contemporary variants, which we expect will be coming. Right now, these current boosters are still very important for us because, again, even though we are able to get infected with the vaccination is also at the same time providing very meaningful protection against serious illness and hospitalization. So those boosters are out for us now. So please check with your provider, and get those. That's really important.
And that's the key, protecting ourselves now so that people are not getting seriously ill and perhaps even dying. Dr. Tokarz, thank you so much.
Thank you so much.
Ben Lourdes.
Thanks, Tina. Up next for us, special honors for a retired teacher who earned a place in history.
And why one suburb is forced to keep a popular pool closed this summer.